Namaste, good morning, good afternoon, and a very good evening to everyone who's attending this live session. Before I start with the live session, there's this one small thing that I learned from our speaker, Dr. Dirk, and that is Herrlich Willkommen. So to everyone who's attending this session from the German-speaking countries, a warm namaste to you on behalf of Team DentistChannel.Online. My name is Ruben, and this session in particular is not really like the ones that we are doing on a regular basis. This has to do a lot with the scientific gist, as well as a touch up on a very important topic, and that is, you know what that is. So ladies and gentlemen, here's me presenting Dr. Dirk. Well, most of you all know who Dr. Dirk is. Dr. Dirk has been working on a very noble cause, and that is because he knows what happens if the implant is not really the perfect one that you are using. Of course, there are a lot of good things and bad things about every implant, but the worst thing is having a foreign particle in an implant. And that is what Clean Implant Foundation, along with Dr. Dirk's principles as well as his leadership, is doing for the betterment of this society, so that for every implant that is placed, that is the perfect implant that's going in the mouth. At the end, you want a patient who's going back with a happy smile and not the one who's coming back and telling you that, doctor, I feel the implant's failing. Or maybe if you're feeling that, the implant's not really working, that is a lot of work to you, but particularly a very sad thing for the patient. Because for you and me, ladies and gentlemen, the most important thing is to restore a patient's smile. So once again, it's my honor and a privilege to welcome our speaker all the way from Germany. Though we are not present physically, we are connected virtually. And what a beautiful way to connect with all you lovely stalwarts and pioneers like Dr. Dirk from various parts of the world, who are not only working as passionate implantologists, but are making sure that the others who are placing implants are doing the right thing by placing the right implants. So that is the reason why we had this topic which says better safe than sorry, why we need more quality control on dental implants. Everyone's talking about quality. Everyone's talking about the uniqueness in their implant systems. But what goes behind that is the true and the remarkable study that Dr. Dirk and his team has been doing. So hats off to you, Dr. Dirk. And I'm sure that all your lovely teachings would help all our fellow implantologists who are watching us from various parts of the world to understand and to make sure that the implants they are restoring or rehabilitating go well, and the patient, when he comes back, will come back not with the sad news, but will come back with a happy smile. So ladies and gentlemen, once again, a very warm greetings to each and every one of you who's watching us from various parts of the world on various channels. A little bit about our speaker, Dr. Dirk. Dr. Dirk Duddeck studied biology and dentistry and specialized in implantology. He is the founder and the managing director of the Clean Implant Foundation based in Germany. He's a guest researcher at the Charité University Medicine, the Berlin campus, Benjamin Franklin at Department of Prosthodontics. He's a member of the British Academy of Implant and Restorative Dentistry. He's also a member of the Academy of Osseointegration and an AO member of the European Academy of Osseointegration. Ladies and gentlemen, presenting to you Dr. Dirk, all the way from Germany, live.
Well, thank you, Ruben. Hope people can see me. Can you see me?
Yes, sir.
Wonderful. So thank you for this wonderful introduction. Most welcome. And it's really an honor and a pleasure to speak to people worldwide about an interesting topic that maybe for some guys and for some people in our business off topic, but in terms of the general praxis, the day-to-day, we have to see people suffering from implant that were not perfectly, we may have some answers to you, and maybe it's kind of interesting next 45 minutes or so. And I would love to start with a video presentation, because I think it's important that we see the complex picture of this problem and find some answers to questions I receive on the daily basis. So let's see the next 18 minutes. It's a TED style video. We integrated two interviews with interesting people who have to say a lot about this topic, contamination on dental implants. So let's see the video, and after 80 minutes, I will be there to answer every question.
Welcome to this video presentation. My name is Dirk Duddeck. Like most of you, I'm a dentist. I'm also the managing director and head of research of the Clean Implant Foundation, a non-profit organization that performs non-biased quality assessments of dental implants since many years. I have some bad news with consequences for all of us in implant dentistry. But I have some good news too. Let's start with the bad news and dive right in. Imagine these numbers. In 2019, the US Food and Drug Administration, FDA, released 2 decades of previously unpublished data, including 2.1 million reports of failed dental implants and more than 100,000 of which refer to 2018 alone. Most of these failures related to a lack of osseointegration. You know better than me that the number of additional unreported losses is likely to be much higher. And maybe this is just the tip of the iceberg. Comments made by manufacturers regarding these figures focus on patients. Patients with unfavorable clinical preconditions, and even blame us, the dentists, for our lack of experience and training. Is this the whole truth? In our recent quality assessment study, conducted in collaboration with the Charité University here in Berlin, we unpacked more than 100 different sterile packaged implants in a clean room environment, including ceramic and titanium implants, and performed with these implants elemental analysis of the surfaces in a scanning electron microscope. What I found in the microscope is presumably beyond your imagination. We analyzed all implants in an officially accredited testing laboratory according to ISO 17025. And here is the bad news. Almost every second implant showed alarming impurities, unwanted particles from the manufacturing, handling, or packaging process. Significant amounts of foreign body particles 1 to 10 micron in diameter, and thus small enough for phagocytosis, were detected on the sterile implant surfaces. So we found iron, chromium, molybdenum, copper, tin, tungsten, nickel, and even major organic contaminations. You may think, should we as dentists really be concerned about using sterile packaged implants with factory-made contamination? I ask an expert who knows better than all of us exactly this. Nice to be here in Gothenburg at the Sahlgrenska University. If I remember, it's about nearly 3 years ago that we met in Cape Town, first time. And in the meantime, we established together not only the Clean Implant Foundation, but also the Trusted Quality Mark. Is there a reason that a dentist nowadays has to be concerned, not taking everything for granted?
I fear so. I fear that I've seen some of the quite a few actually of the images you have produced from these implants. And in the beginning, I must admit, I was astonished that they could sell some of those implants to customers that they do sell. And I fear that this may be one of the reasons that we have overlooked in the past, that implant impurities that haven't been cleaned away can pose a problem. We don't know precisely today. We don't have any precise levels of what we can tolerate and the human beings can tolerate or not, but I would certainly prefer things to be clean compared to having to find out where the borderlines are of dangers.
Yeah. Actually, it's thinking about the threshold. Whenever I speak to my colleagues, coming from a more academic point of view of statistical data and numbers, if they have a choice to use a clean implant for their relatives, the answer is quite easy. They will always choose the one without a question mark, right?
And for myself, not the least, I would add. Right? So this is something that we assume, however incorrectly, that implants that are placed in human bodies are clean. And we have learned, not the least from your studies, that is not the case always. And to me, this is sort of something we have to find out and learn more about, and how to minimize the impurities on implant surfaces. That's of major importance for the future.
The findings themselves, and in many cases the reaction of manufacturers to these results, are really disturbing. It seems that it is easier to kill the messenger than to take the news seriously. Maybe they should think about their responsibility of the manufacturers of medical devices and get to the bottom of the contamination. Instead of this, I heard accusations like, "Oh, you have caused the particles yourself. You manipulated the images with light and shadow in the dark room of the electron microscope. Anyway, the particles were melted under the microscope. Pretty hot in this microscope. And impurities cannot be avoided and are not clinically relevant." Okay. This is the smoke screen technique, hiding behind stupid arguments, no matter how false they are. What about biology? These contaminants on sterile packaged implants, especially organic particles, can cause an uncontrolled foreign body reaction, resulting in osteoclastogenesis, an increase of osteoclast cells that mediate bone loss, and thus leaving rough areas of the implant surface exposed to bacterial colonization. Additional analysis of these organic contaminants using time-of-flight secondary EM-mass spectrometry, TOF-SIMS, revealed thermoplastic materials, synthetic polymers, polysiloxanes, and even dodecyl benzene sulfonic acid. Stop. Dodecyl benzene sulfonic acid. DBSA is found in washing detergents, and it is a hazardous surfactant, according to the US Environmental Protection Agency, the EPA. This raises a completely different question besides possible bone loss. Can these impurities also have toxic effects? I don't know. I found a really interesting answer in Brisbane, Australia, but moreover a scientifically based approach as to how we as physicians should basically deal with the problem of the avoidable contamination of medical devices such as a dental implant. So let's go in and ask one of the world renowned experts in toxicology. Professor Jack, we're here in Queensland University at Pace. I came to your institute with some questions about the consequences of contamination on dental implants. What do you think, from your point of view, the academic point of view, do we have to be concerned about avoidable contaminants if it's either surfactant or remnants of laundry detergents like DBSA or silicones on dental implants?
Yes.
What do you think?
Generally speaking, all the above has got some toxicity. It could be nanoparticle, it could be microparticle form, and that involve a different scenario toxicology because the local particle can cause a local reaction, whether it's in mixture or in single. So how much of that can interact with the local environment or also absorb in the bloodstream and carry to the target organ, who knows?
I assume we're on the same page and we say if it's avoidable, we have no problem and no question mark, right?
Yeah, I would think so. So it's early stages, you always tend to be on the cautious side,
Yeah.
right? Yeah. The precautionary pensionable.
So much for the bad news. As a consequence of the obvious lack of quality control in implant manufacturing, the Clean Implant Foundation introduced a globally recognized test procedure in 2017. Our independent organization published a consensus-based guideline with thresholds that lead to the award of the Trusted Quality Mark. This test procedure and the corresponding analytical process always requires the testing of 5 implant samples, 5 implants of the same type. At least 2 of them are obtained directly from dental practices on a random basis, so that any factory manipulation or the dispatch of particularly clean test samples can be ruled out. Before the seal of approval can be awarded, 2 members of the Clean Implants Scientific Advisory Board independently review the results of the technical analysis and the clinical documentation of the implant system. The results have to meet the current criteria, and the documentation has to give proof of a survival rate of at least 95% over more than 2 years. Renowned experts such as Thomas Albertson, Anne Vanderberg, Michael Norton, Florian Boyer, Scott Gans, Jafar Mohi, Luigi Carnullo, and Hugo de Bruyne. All of them form the Scientific Advisory Board. These experts are responsible for the peer review process. Their signatures on the final Clean Implant Trusted Quality Mark guarantee an unbiased quality assessment. To date, implants that meet the criteria of the quality seal are, for example, the BTI from Spain, Megagen from Korea, Sweet Martina from Italy, Bredent from Germany, the Medentis from Germany again, and from France, the Global D. Other systems, including ceramic implants, are currently in the process of analysis. This is how a clean implant looks in detail in the material contrast mapping images. a technique where we collect more than 400 single SEM frames and compile them electronically to form one big image of the complete implant. You can see the surface from the implant's shoulder to the apex in a breathtaking magnification. No cherry picking of nice looking areas. We always have to see the full implant as a basis for any rating. My dear colleagues, it took a lifetime to build up your reputation as a dentist, clinician, and expert in implantology. But how quickly can you lose your reputation by using an unsafe medical device in your practice, in your clinic? As a dentist, patients trust your decision. But using implants of inferior quality for your patients means two risks at the same time. Impurities may induce an uncontrolled foreign body reaction, resulting in peri-implantitis, bone loss, and so on and so on, and thus compromising the clinical outcome and, most of all, your patient's expectations. And if it turns out badly, you may have to take the additional risk of patient lawsuits for dental malpractice. I guess both risks are avoidable. Instead of only blaming inexperienced clinicians or patients with unfavorable preconditions for the high number of FDA-documented implant losses, we should think about the fact that contaminants on sterile packaged implants, in other words, a lack of quality and sterile dirt that is technically avoidable, all these can play a significant role in the incomplete osseointegration of dental implants, bone loss, and the early healing phase, and probably even the failure of the implant. In these difficult and extraordinary times, the very last thing your patients need is a contaminated dental implant in their bones. So now it's up to you. It's time to build up trust. We have two situations. Good, if you use one of the certified clean implants that already show the trusted quality mark. You can sleep well tonight. But please do something about it. Pass this information on to patients and colleagues. Inspire confidence with a personalized certificate in your clinic and on your website. If you like any material, we'd be happy to send it. Or if you cannot find information about your favorite implant system on our website, send me a mail. Our database has much more information. I'm looking forward to your comments or requests. Thanks for watching. Take care and stay healthy.
All right, ladies and gentlemen, that was a lovely presentation. I think that was an eye-opener to each and every budding as well as future implantologists. Ladies and gentlemen, most of y'all might be having a collection of watches. Some might be having a collection of stamps. Probably some might be having a collection of even coins. But there is somebody who has a special collection, and that is Dr. Dirk Duddeck. And you can see that he's having a collection of implants from various parts of the world. And that is how passionate Dr. Dirk is about spreading the positive message about Clean Implant Foundation. So if you all wish to have a collection like Dr. Dirk, I think you all have to understand and be a part of the Clean Implant Foundation. And that is only possible if you understand the severity of the situation and how a bad implant will affect you and your dental practice. Ladies and gentlemen, I think we are open for an question answer session. Before that, I would like to pass the mic to Dr. Dirk, who can share his views further on the topic. Over to you, Dr. Dirk.
Thank you. So you can hear me?
Yes, sir.
Wonderful. Yeah, thank you for watching this 18 minutes. I hope it was not boring. And from my personal point of view, the complete story, let's say the complete topic, looking on the cleanliness of dental implant definitely changed my life as an oral surgeon and an implantologist. And I'm concentrating fully now on this very important thing, as as you saw in the video, it looks like the market is losing control about the quality in general. That does not mean that there are fine implants on the market. However, the more implants we have on the market, the cheaper they get, the more the problem may arise that we unknowingly use as dentists implants that have these kind of interesting or dramatic contaminants. And remember always, all these contaminations are technically avoidable. So there's no fate, it's nothing from heaven. It's just, some companies say, well, it's not a problem at all. They can do better. And we as dentists should force them to do better, to send us the best implant that is technically possible. So room, some questions. I would love to hear some questions. Okay. For example, what we sometimes hear in after my lectures is always the same question. So, well, Dr. Duddeck, in my personal view, this is not a problem at all. My patients are not dying. They're happy. I have some cases where they come back, get a new implant, they pay twice, so not a problem at all. I say, okay, if you see this problem from an academic point of view, from a statistical point of view, there might be some percentage of losses caused by these particles. A percentage of patients who are losing an implant after any number is a human being, is a patient trusting in your decision for the right implant, for the best implant in this specific case. So your decision should be always made not by the best price or let's say the best offer or some extra benefits companies offering to you. It should be based on the information that you receive from neutral testing, because we saw too many companies promising too much and delivering not what they promised.
Thank you, Doctor. I think before we move to the questions that I have already received, I would like to ask our participants to pose their questions because, ladies and gentlemen, this is not a scientific presentation. This was more of an eye-opener to you before you go and rehabilitate a patient with an implant. So I want all of you to please feel free to post all your questions because this is the time to ask your questions to the person himself who's actually been researching on how to get the best of implants from all across the world. So we are open, the stage is set. Please post your questions in the Q&A box. Please feel free to post any of your questions. I'm sure Dr. Dirk would love to answer them all. So I'm 2 minutes of your time. Please post all your questions.
I may just tell something about my experience in the last up to 13 years in this topic. We received a lot of feedback from companies as well. When we showed them our data, some companies are surprised, some companies are shocked, and some companies say, well, they don't care at all. So we get the full range from a complete, they turned over every stone in the factory to get rid of this problem on the implant that they are packaging and sending to you in the best belief that this is a clean implant. And I showed them from different batches, from different lots, that these implants were not as good as promised. So they changed a lot of things. I know at least 2 companies who invested a huge amount of money in new machines and new engineers just because of our research. And finally, they came back and they said, please test us again. And this was a wonderful moment when we saw that the outcome of this improved factory quality management was really good. So some of these companies you saw in the videos have already the trusted quality mark. And this is not an easy process. You cannot buy for no money in the world this quality mark because we have this process that is completely unbiased. We have no chance, I personally have no chance to manipulate any data better or worse just because I love someone from the industry or not. So because we have a peer-reviewed process, the data is achieved in a in a accredited, officially accredited laboratory, and that is not an easy way. We have different external audits, so the way we do it, even it's ridiculous. Unpacking in a clean room environment. That means that we have to invest in this clean room for this 10 seconds of unboxing the implant and then transfer it to the sample holder of the SEM, because we received not one, not two, more than 3 emails saying, well, maybe you spit on the implant. Maybe it's just occurred from a process of unprofessional unpacking. So this is, we closed every gap. So this is a process of analysis that is, I said the only outcome is we see what we get, and the industry has to give better answers than, let's say the spectrum goes from, in best cases, yeah, we change our factory, we improve on quality management, to severe threats of legal actions. And I received more than 2 emails that really, no one wants to receive these kind of emails, because these are powerful manufacturers, companies worldwide acting. And if they let the dog off the leash, I mean, asking the lawyers to zip the mouth, to kill the messenger, it might be the cheap way, but I don't think it's a fair reaction on an open communication where we have no sympathy or no hate, nothing. We just show the data to the company. And so from legal threats, in the end, I received a call last year, end of last year, from a CEO of a company, and he actually told me, Dr. Duddeck, you should better not walk outside in Berlin at night, because I know people who can do things to you you won't like. And that made my blood run cold. So we speak about the full range. Let's see it positively. The glass is not only half empty, it's half full. We are on a good track, and companies following us, acknowledging that this kind of testing is on behalf of the dentists worldwide. We have on the daily praxis, you see patients sitting in front of you, and they have no clue about surface treatment, no clue about osseointegration. They don't know how this works. They just want a clean an implant that works, finally. And we give them a promise. This promise should be based on knowledge. We should know and not just believe that implants are as promised as clean and they work fine. So this is an interesting thing for us. In 2014, so I made at least 4 studies with the same setup for the last 13 years. And in 2014, there was, I just looked for a pattern of reaction, of is there something, is it the cheap ones, is it the companies from countries far away, so is it just only German good and Swiss good and the other one is crap? There is no pattern. So neither the country of manufacturing, nor the size of the company, nor the price of the implant gives a guarantee that your implant is clean and free of avoidable contaminants. So this is something we learned, and the only pattern we found in the previous research was the more companies try to get rid of this research, try to avoid the testing. We asked for an implant. They said, no, we don't send it. We said, okay, I buy it. I just went on a booth on a company in Congress in Dubai 2 years ago and just put on 200 euros on the table. I want to buy your implant. They won't even sell it. So we had to do some blind shopping. The companies tried sometimes to boycott the information. And this is the only pattern I found in 2015. The more the resistance or the more they try to boycott the study, the more contaminated these implants were. We found severe contaminants, massive contaminants on these kind of implants. So if they're trying to hide something, I think we should know better. Okay.
All right, doctor. I think with that, we are good to start with the question and answer session. I've received a lot of questions. And one of the very common questions that I have received is, how do I know if my implant is clean or not?
First check will always be on the website cleanimplant.org. We have already awarded 10 implants so far, worldwide traded, and probably available also in India and worldwide. And if you cannot find this information on our website, the easiest way is to become a member, to support our project. And the colleagues, please should understand that we are not broadcasting here any specific names now. Like say company, what about company A and B? And say, well, thumbs up, thumbs down. I do it once and then I will be in jail or will sue me immediately. This information not to have the case of misuse or we get in trouble here with the nonprofit organization because we don't want to spend our money on lawyers. We spend our money on research at least. And the only thing is, well, we have to check implants, and then people will see if they are members. They will always get answers to their implant. We have more than 300 different implants checked over the last 10 years. Implant types, more than 240 companies, I guess. So in the recent study, we have already, again, an update of more than 100 implant types. So we have a pretty good database, and then people will receive the information, this information they want to have for their practice. So they sleep better, they know better. And this is one topic specifically in countries like the United States, patients try to sue the doctor for any reason. And if they find the reason that implants might not be clean, we have already a case where we we help to defend the colleague who is a member. And this gives the proof to patients as well if we have the information about a good implant. So to cut a long story short, colleagues always get an information if they help us, if they support the project. And we speak about, I'm not the money man, a monthly rate around approximately 30 euro something. If they support us, it's not only that they get information about their implants, we also give legal assistance because we check this case of an unjustified negligence claim, for example. We do the full process of analysis with the implant from the doctor's practice. And this is much more expensive than any yearly rate a member can pay for. So they get the document based they get documents based on the report from the accredited institute. And this is, these papers work in the legal case pretty good. So if a patient is trying to sue a doctor about having unknowingly used a contaminated implant, we show in the case that there is definitely not the problem, if it's the case. And we give out some warnings, we have a newsletter and everything like this. So there's many, many good reasons to support this project. You will find anything, by the way, on www.cleanimplant.org. So much advertisement has to be done. Okay.
Thank you, sir. I feel it's not really the advertisement, but it's the awareness that we are creating for the betterment of implantologists all across the globe. So we have a question from Dr. Sachin Bhalla, who's asking, for what literature should we ask the manufacturer or supplier while purchasing the dental implant?
That is a good question. We have some cases where clinical cases are not documented at all. Some companies have a lack of clinical documentation for good reason. One, let's say one topic in the from one criteria in the trusted quality mark is not the cleanliness itself. It's also that the companies have to provide clinical cases published in peer-reviewed journals. That is important. Peer-reviewed journals about survival rate of more than 95% over a period of longer than 2 years. So we don't want to have any happy-go-lucky implants like they can. I got offers from Pakistan, from India, from all over the world. Doctor, I can manufacture any implant you want in 10 days, and you will receive something that looks like an implant. There's no proof. There's no quality management at all. So this is an important thing to think about. Yeah.
Next question. Can you tell us if there are companies from Switzerland and Germany who are manufacturing impure implants? Should be impure implants, yes, or contaminated implants.
That's a very good question, a very short answer. Yes and yes. We have companies from Switzerland and companies from Germany that produce implants that, say it politely, have a lot of room for improvement.
So it's not just about a particular country or a particular nation, it's all about the world. So the conditions prevailing all across the world.
Exactly, exactly. People should think about if they order an implant. Let's say if you think about to receive an implant for 15 euros, about 40 Brazilian real or something like this. What do you expect for 15 or 20 euros or $20? A screw. It maybe look like an implant, but the company cannot provide quality management, cannot provide any clinical cases giving proof to the doctor and to the patients that this implant lasts longer than a year in the bone. So there is the country of origin is no pattern. The size of the company, unfortunately, is no guarantee. They always try the best to produce the best they can. The bigger they are, and sure there is a quality management, and these are not. There's a differentiation between a garage fabrication site and a bigger company. So. But this is no guarantee at all. So we, I remember in 2016 or 17, there was a huge recall, a larger recall from Nobel Biocare. At that time, we found these contaminations on Nobel Biocare implants as well. So this is, we had a meeting and they tried to explain me. And finally, they made a recall. And they saw the problem. They took responsibility and they get rid of the problem. They solved it. The problem is with very tiny garage fabrication sites, they don't have the power to do a recall at all, and they will be bankrupt. So let's say you always have to see how companies react on the information, and if they try to avoid any information at all, try to control the narrative instead of improving the factory, this is always the wrong way. Truth always comes out. Finally, in the end, it will be in the praxis. It will be the patient suffering from implants that they have a very early peri-implantitis, for example. The loss of bone is, in the video, it might be a little bit short. The loss of bone is always a consequence, not always, is in some cases, the consequence of an uncontrolled foreign body reaction. You have to understand that osseointegration itself is a process of a controlled foreign body reaction. An implant is always a foreign body, but the additional foreign bodies like unbelievable dodecyl benzene sulfonic acid or copper, chromium, tin, bronze particles from the manufacturing, from the packaging itself, from the manipulating the implants, sticking together the implant, putting it in the packaging, all these might leave traces, and these traces have an effect on foreign bodies. They are foreign bodies, and they affect foreign body giant cells. So we see that macrophages try to clean up, sort of, And in the follow-up of any increase of macrophages, we see an increase of osteoclastogenesis. So the body tries to get rid of the bone as well, not only from the contaminant, but also from the bone. And this is the initial state where you see the gap, or let's say the bone seal on the implant shoulder is open up. And when you have rough surface open to bacterial colonization, the rest is like a domino game where after bacterial colonization, you may try to save the implant for another year, for another 2 years, maybe for another 5 years. And you have a pocket that is growing constantly. And finally, you have the problem that the implant might lose the contact to the bone at all. So there is always a reaction on foreign bodies. Anything else is a lie. Foreign body lead to a foreign body reaction, period. And this is something we should take care for.
Thank you, doctor. We move to the next question. I would like to know that whether success of an implant will be based on the material of the implant or the procedure, how we do it.
That is a good question. It is always the chain of steps of surgical steps. So the good planning. You can make a mess if you just have no planning at all. If you just drill a hole in the bone and put in the screw and don't know where it comes out, and the technician says, "Oh, I cannot solve it." So it starts with the good planning, and then for sure we know everybody good education. You should know what to do. You should have techniques to manage the bone. Anything in this complete chain of implant dentistry leads to success. And if just one part of the complete chain, it might be the lack of education. It might be a lack of quality. It might be a lack of dental hygiene. So in the end, we are just speaking about one domino stone in the complete row that leads to success. Okay, so it's not the only one thing we should care for. But if we don't care for it, it's the only one thing that leads to, for sure, to a problem. Not always to a loss of an implant, but to complaining patients, to peri-implant mucositis, to peri-implantitis, loss of bone. It's a complete story. All of you know this better than me.
Thank you, doctor. Next question. I think it's a very good question. It says, what about a company which has already been recognized as a company which is making implants which are free of impurity? Is there a chance that that same company can manufacture a contaminated implant?
Unfortunately, yes. We have this, it's very easy. Some people try to understand this manufacturing of implants and quality issues. Compare it to the car industry. We had this B-class Mercedes-Benz that flipped over in the ELK test years ago. And they tried to steer against in Sweden. So the Mercedes-Benz car flipped over the street. So they, at that time, they had, let's say, a less better quality, a less better management of the steering and anything else. So the car was not stable, it was not good. A good company produced a car with room for improvement. So we have the same in the implant business as well. We see, for example, now companies opening a new box of, not of Pandora, but of material. The new chapter is the zirconium material. And just because zirconia implants are white, or they even look fine on the first sight with a light microscope, they have the same problems as titanium-based implant, whether it's titanium grade 4 or grade 5. Zirconia implants have to follow the same, let's say, criteria on quality management than titanium implants. And just because they are white, they are not cleaner. And we're actually publishing now, I just read it with a final paper, and we send it to the peer review process, a research on 5 zirconia implants, where we tested 5 implants from each type. So it was more than 15 implants, no, 25 implants, 5 times 5. And then we saw that some of them showed really room for improvement. Severe contaminants avoidable from the packaging, for example. If people follow us on Facebook, or they will join us on the, at least sign in for the newsletter, they will know in the moment we have the publication, it is published, and the peer review is over, then I can speak about it. But now in the peer review process, I have to zip my mouth a little bit. And this research together again with the same team we made with titanium implants before was Thomas Albrechtsson, Anne Vanderberg, Florian Boyer from the Charité in Berlin here. So we have very, very good people. Jafar Mouhi, he's one of my friends from Morocco. It's an international team that checked these implants. And zirconia is not, let's say, per se the better alternative. It has to follow the same rules of quality management as titaniums have to. Okay.
We move to the next question. The question is, we're getting an overflow of questions, so we quickly have to move with the questions because of the short availability of time. The next question is, what is the source of impurities to be present on the sterile dental implants? Which surface modification technique can render almost pure dental implants?
The origin of these contaminants is you see the complete history of the manufacture of an implant if you see it under the scanning electron microscope. You see, for example, tungsten from the machining. You see polyethylene from the glove that touches the implant during the quality control. So you see packaging material like polyacetal, POM, POM, or tin bronze from the blasting nozzle. So we see different materials on the implant that are sticking on some silicon-based remnants that resist the cleaning process. So this is a complete spectrum of organic and inorganic material. And we see it pretty clear in the scanning electron microscope as we use the backscatter electron technique, where we have a material contrast as well. So black spots are not really black, they have less electrons, so we see there's organic material. And we go on the focus the beam on these particles, and we get the information on an elemental basis. If I want to know more, we have a systematic contamination, or let's say the complete shoulder is always the same particles in the same location. We can use a sterile package run from the same batch and do the time of flight secondary EMS spectrometry, as I told in my video. There we get the information about the chemical substance. So this leads in the end to the clue where this occurs in the company, in the manufacturing side. So if companies want to have, let's say, better quality, they can contact us as well. So we are not exclusively sharing our knowledge with dentists, companies that are on the way to a good implant, that want to improve factory side. We are experts. We have so much data. We have so much experience. They can address us as well.
Doctor, we move to the next question. As per the documentations in the literature about implants, roughly how many percentage of implants fail, even though the standards of the quality specification of implants are met? Is it so that if the quality of implant is met, the job is half done?
Again, the quality of an implant is part of the success. Failed implants, it's not, we can't blame the contamination of implants to all failures of implant. We know from it was interesting because the Kaiser Health News published the FDA data, the information about 2.1 million failed implants. I was actually shocked hearing about this. So these, it was more than 100,000 reported failed implants, and they try to blame patients, and they try to blame our lack of education or surgical techniques. And I'm sure that a huge percentage of them will be the reason. The contamination will be the reason. So this is, in our case, we found from 100 implants, more than, let's say, more than 3 out of 10 showed avoidable contaminants. This is far too much. In case you have more questions, and you see all the questions now coming in, I would actually emphasize that people could send us their question via email. They just should write an info@cleanimplant.org, and I'm happy to answer all questions. Okay, so
last question before we wind up this session, and the $1 million question: how do we become a member?
It's pretty easy. They can join on our website. They find information in English, French, Portuguese. So we have some languages already there, and we explain the benefits beyond the knowledge of a good implant they use in the future, or knowing that they should change the manufacturer, for example. They find anything on our website, and they can sign in directly there. And I will be more than happy to have support from new members as well.